We have per capita much more inoculation than in the United Kingdom, but in terms of the third dose, the booster jab, not enough people have yet come forward to have their jab, although we have the vaccine. And I know that some people have been reticent because they've heard that you could have side effects and they've wanted to finish their Christmas shopping or not have the jab if they had some other Christmas plans. I implore people, we have the vaccine in Gibraltar now, I implore people to go and get their third booster jab as soon as possible. Walk-in clinics are now open at the Children's PCC at Europort. It is very easy to just pop in and have your third booster jab, because that is what's going to give us the maximum protection for the GHA and for each other as a community to ensure that Omicron is not a tidal wave through Gibraltar.
What's been the take-up of the boosters so far? GBC's calculations put this at a little over 50%, at around the 56% mark. And what would you say to those that worry that this third dose will then lead to a fourth, fifth, or maybe more in future?
So we calculate just over half of the people who have been eligible to have their first and second jabs in Gibraltar have already had their booster jab. We need to ramp that up now to get the same number of people who had their first and second doses to have their third jabs. We need to push this up towards the 39 or 40,000 people. And, frankly, the question of whether or not we're going to have a fourth jab, a fifth jab, whether we're going to have to continue to have inoculations against coronavirus is not something that we can predict now, but it's in the nature of science to give us the necessary inoculation against the things that we might find. People who travel to destinations where they might need to take other inoculations do so however many times they might need to travel if their immunity is deemed to be lowered by the affluction of time, etc. So we have to be ready to do that. That's the world in which we now live after the arrival of COVID last year. I would not consider that to be a reason not to have this third jab. We don't know enough about Omicron yet. We hope that with the number of third jabs that we have available in Gibraltar, we have 20,000 doses. We've already given 22,000 doses of the third jab. That can get us to a full inoculation with a third dose of all those who have had their first and second jabs. If you haven't had your first or second jabs yet, I implore you to have those. Go to the CPCC. Let's have the whole of the doses available to you, and please, if you're looking at what's happened to those who in the past have been anti-vaccine, who have not wanted the vaccination and have then ended up in a hospital bed saying, I wish I'd had the vaccine, and in some instances losing their lives saying, I really wish I had not been against this vaccine. I wish I wasn't about to lose my family. I wish my family were not about to lose me. Take them as the example and please have the vaccine.
You mentioned, of course, that the booster program is being run out of the CPCC. We have seen that some of the children's services at the centre have been impacted by this. So is the government doing anything to mitigate this?
Yes, we are. Remember, we didn't have a CPCC until 2019. We were able to operate without a CPCC. A children's PCC is something that we brought about. It was our policy to have it. But of course, we now need to use all of the resources of the Health Authority to deliver this third jab, and the CPCC is the best place to do it. In the United Kingdom, they're talking about the NHS not being able to continue to do even cancer care, etc. Here, what we're doing is displacing some of what we do at the CPCC whilst we deliver this important booster third dose of the COVID-19 vaccine. What we have to be clear about is that we cannot do everything. People have to realize that there is a limit to what government and what the Gibraltar Health Authority can do. We cannot deliver normality as we deliver the third dose and as we go through the pandemic. We cannot deliver normality as we go through Brexit. There are limits to the government's action, and it is irresponsible of political parties to suggest that we would be able to deliver normality as we deliver this third dose.
In the UK, the NHS is under some stress, but how is the GHA faring, and is the pressure expected to increase?
So the GHA is in a good place in relation to the number of people in the hospital. We have, I think, 2 people in the hospital with COVID at the moment, none of them with the Omicron variant, but we are stretching ourselves in order to be able to deliver the third jab. And there is a real pressure on the GHA. Remember that at the same time, there's the pressure on testing. We're testing and we're doing the genomic sequencing. All of that is additional pressure that is being visited on the GHA from March last year, and that pressure has continued continued. So we do need to understand the strain that we're putting our healthcare professionals under. Even when the real estate is available and you have the beds available, you're still requiring your healthcare professionals to do more in order to reach out to the community to deliver that third booster vaccine. And that means taking people from mental health services, from different parts of the organization, who are the people who are trained to be able to do the booster jab.
Booster doses are being offered to university students, so where is the booster program at the moment in terms of the ages covered, and will it be rolled out to cross-frontier workers as well?
So we are going to, of course, inoculate all those cross-frontier workers who were able to have their first and second jabs here, or who are now qualified to have their third booster jab here, and any university student who is coming to Gibraltar, who comes to Gibraltar, and if the walk-in clinic has by then been suspended by closer to Christmas, they can register online to have their third booster jab by appointment instead, if necessary.
And along with the booster program, there's also a reminder that there are other restrictions still in place, along with public health advice.
So, of course, the third booster jab is the sharp end, the tip, literally, of the iceberg of what we're doing. But a lot of what we need to do is in the way that we behave. It's in continuing to maintain social distancing where necessary, to ensure that you're wearing your mask in the places where you're required to wear your mask, and to not take unnecessary risk. We know that the one thing that is clear about Omicron, which is already in Gibraltar, is that it spreads much more easily, so we need to try and protect each other from that spread. There may be asymptomatic people with Omicron who could spread it very easily. Wearing our masks protects us, and it protects if we haven't got the variant, we haven't got COVID, it protects us from catching it. Wearing our mask also helps us to protect others in the event that we do have COVID and we don't know that we have COVID. It stops us from spreading it. So it's hugely important, especially if you're going to something like a funeral, for example, if you're going to other indoor events, please wear your mask. And I would say to some people to be conscious of the situations in which they are in, and to perhaps even consider wearing masks where it is not mandatory to wear masks, but where it's prudent to wear masks.
Given what Boris Johnson has described as a tidal wave of Omicron, is the government here contemplating increasing restrictions at all?
So at this stage, we believe that Gibraltar is able to continue with the restrictions as they are today, because remember that Gibraltar did not take a step down from mask wearing in the same way as the United Kingdom did. So we always maintained mask wearing in public transport, we always maintained mask wearing in shops, which is what the United Kingdom has now brought back, and if necessary we will look at how we permit events in order to ensure that the work that has got to be done to make that event safe is done under the supervision of public health. But we don't envisage other controls at this stage. But of course we are, I must tell you very frankly and very openly and very honestly, we are at the mercy of the pandemic.